This is Brent of the Brookbush Institute, and in this video we're bringing you another self-administered joint mobilization for the hip. This particular joint mobilization is an anterior to posterior mobilization with hip flexion. It works really good for anybody who you think might have posterior hip tightness. This would specifically be those with lower leg dysfunction or lumbopelvic hip complex dysfunction. Probably works best for those individuals who have knees bow out, or the dreaded butt wink that's become such a big topic, which is that early posterior pelvic tilts in the descent of a squat, generally meaning that you have a restriction in hip flexion. I'm going to have my friend Melissa come out. She's going to help me demonstrate. Now she's going to hook one of these big 1 to 2 inch thick monster bands around a very low anchor. Make sure the anchor is heavy and stable, it's not going to move. As she moves close to it, she's going to loop the band around the leg of the hip she wants to mobilize. She's then going to use the other leg to kind of scoot back with this hip inflection to get all the tension she needs. Now you guys need to have the band as close to your hip as you can. That means right up against bikini line for girls or brief line for guys. Be very careful. These bands produce a lot of tension. If you get any little bit of skin from your gentler areas caught in this band, you are going to be speaking an octave higher, there's no doubt. So make sure the band is in a comfortable position, it's not pinching skin, but is as close to your hip as possible. You're using this opposite leg to stay stable and keep the amount of tension on the band. So you guys can see already the anterior to posterior pull on the hip joint. Now we just have to work on hip flexion with this mobilization, and we'll have completed this technique. Now, unlike the other techniques I've shown you guys where you kind of rock the body, in this one you are going to be responsible for mobilizing your leg. You want to keep those acute variables in mind. So this is 1 to 2 pulses or oscillations per second for 15 to 30 seconds or 30 to 50 reps. It's only going to be 2 to 3 inches, and you're going to want to be doing that oscillation at the very end of your hip flexion range of motion. All right, so Melissa's just a little slow here. If she can speed it up a little bit, right? So that would be a nice tempo for an oscillation. I've talked about in a couple articles now, in a couple previous videos, you're probably not going to feel a whole lot when you do these mobilization techniques. I don't want you guys going for that feeling of an intense stretch, like you're doing a hip flexor stretch or a lat stretch, or that intense amount of tenderness like when you do a release technique. You're probably actually not going to feel that much when you're doing this. Maybe just a little stretch deep in your posterior hip. After 15 to 30 seconds, you're going to stop and retest. So if the reason you did this was because your knees bow out during an overhead squat, I'm going to go ahead and have you do that overhead squat again and see if your knees bow out got better. Of course, if you have any pain in your hip during this technique, cease immediately. This does work pretty good. Let me have you go ahead and switch legs. We'll pretend that you have bilateral problems. As I mentioned before, this does work pretty good for the butt wink if your butt wink is coming from a restriction in hip flexion, which it often is. So once again, Melissa's got a nice amount of tension on this band. And the hardest thing, guys, I think, is to get that like tempo and feel of what a mobilization should be, which is a little faster and a little smoother than I think a lot of people do initially. This does take a little bit of practice. And you're just going to do 15 to 30 seconds. You're probably not going to feel much, as I said. And then we would relax. You'd go ahead and take the band off, and we would reassess. Guys, I hope you enjoy this technique. Very easy technique, very effective. I look forward to hearing the outcomes that you got. And I want to hear about some broken records on squats and a little less of that posterior pelvic tilt that I know has been hurting some of your guys' technique. Talk to you soon.